what I want you to think about is the large dining room table with all those extra pieces in them. I'm Italian, I talk with my hands. With those pieces in them, and then a brand new thick foam padded tablecloth. So when we're young, we have a very large table with lots of extra sleeves in them, with a very thick tablecloth, and it's nicely stretched out. I'm not going to be talking to you about the tablecloth part because Autumn will be doing that later. I'm going to be talking to you more about what happens to our heads as we age. So I'm going to use these sort of aids. So hopefully everyone can see them. So when we have a nice thick tablecloth, we've got a lot of fat in the skin, which keeps our skin looking nice and smooth. And when we're, take a step. When we're really young, we have a lot of fat on our faces. We have very thick muscle. We have very thick bone. I'll show you the bone picture. So you can see that we have a lot of bone in our skin. So what happens to us as we age? We start off as babies with round heads, lots of fat, thick muscle, thick bone, and then as we develop, our bones actually elongate and get longer. And so we end up with one of two face shapes, either an upside down egg or a heart. And what makes us look very youthful is a lot of fat sitting right on the bone and thick muscle. So when we're young, we have a lot of eyebrow fat, which allows our eyebrow to be lifted above our brow bone. And in 80% of the female population, it's in a nice arch. Males tend to be a little bit flatter, but it's still above the brow bone. We have a lot of fat within our temples, which allows our face to have the maximum width through the eyes. So if we were to use the eye as a unit of measure, we've got 1, 2, 3, 4, 5 eyes across, and that forms the basis of a triangle, and that triangle we've referred to as the triangle of beauty. Because all of the fat in the face, when we're young, all touches, it actually holds the skin up so that that tablecloth, remember the table I told you to think about, stretches nicely, and there's no, wrinkles, there's no sagging to that tablecloth, and we don't really see many shadows in the face. Maybe a little bit highlight, a little shadow here, but we don't really see a lot of shadows. So what happens to us as we age is a lot of that fat becomes atrophic, it shrinks. And so when we're in our mid-40s, our fat pad becomes smaller and our eyebrows start to sag to the level of bone. So we start lifting our eyebrows every time we want to see something. And as a result of that, we start to make lines in the forehead. And when we think a lot, we start to make lines between our eyebrows. We lose some fat in the temples, and that beautiful oval or heart now becomes more like a peanut in a shell or a woman's body. It kind of looks like that. So now the maximum width is actually through the cheeks. And so a lot of my patients start to tell me that their face is going south. So part of that is because we talk to their cheeks instead of their eyes. And part of it is because the maximum width is actually through the cheeks. When we start to lose a lot of the mid-cheek fat, especially where the fat used to touch here, the fat pads, when they touch on the lateral side of the cheek, hold the skin up. So when you get rid of that acre, all of a sudden the face and the skin starts to sag forward, and we start to see these lines. We have these muscles in the neck that pull into the corners of the lips, and that brings us, we start to get a little pulling here. And we start to lose bone here and here. So this skin isn't supported and it gets longer. This muscle starts to exercise and it gets shorter. And so we start to have that look where we don't have, I have to put the skin up, here we go. So we start to see a little bit of shadows here because there's some interruption in our fat. along here. We may see some shadows under the eye, and actually we may start to see a little line here. And we start to see the corners of the mouth turning down a little bit. As we get older still, we lose a lot more fat in our face, except of course the jowls. That's the only place that doesn't seem to disintegrate that quickly. But now our eyebrow is actually below bone. So a lot of people starting in their mid 50s walk around with their eyebrows up constantly. And so, I'll often ask patients, so do you get headaches? And they're like, how do you know? And it's like, well, because I'm getting a headache just watching you hold your eyebrows up. It's like going to the gym all day. So those lines become more fixed. And when we lose a lot of the midface, everything sags down, and we have these little jowls that pull everything down. And now that triangle is actually reversed. So we have more of this shape, and we start to talk to people talking to their jowls. So, and I'll show you here, a lot of this thick, juicy bone, a lot of this thick muscle, all of that sort of becomes a lot thinner, and it's just not supporting it. So picture that table again, where the tablecloth, now you've taken pieces out of the table's gotten smaller, and that tablecloth is just hanging over the edge and sagging. So what do we do about that? So there's a couple of things that we do. So what do we do with the tablecloth? So when we start to see some of those lines, we use things like neuromodulators. A lot of people refer to them as toxins. I don't really like that term. It's really a neuromodulator. And the function of these products, there's more than three. In our practice, we have Botox, we have Dysport, we have Xeomin. And the function of these products are to relax the muscle so that those muscles pulling on the skin don't pull on the skin, and you get some softening of your lines. We can do it to shape your eyes, so we can face shape with using neuromodulators, but they don't replace the volume or the fat. So sometimes I'll have patients who say, I want more of that Botox you did on me, and it's like, yeah, I did filler. So it's not, the function of neuromodulators is to relax the muscle so that the skin can be a little bit more stretched out. So in a sense, it irons the tablecloth. Plastic surgery, what is that? Well, they basically take that tablecloth, they pull it off. You don't want to know, but they do it. It's removed from the face. Then they cut the tablecloth, sew it back up, put it back down. And so now you have a smaller tablecloth with a seam on a smaller table, which is why if they don't do some volume to the face, people don't look good. So you need to have some volume restored. So what do we do with volume? There's a couple of families of products on the market, some that are called volumizers or biostimulators. And the reason they're called that is because the body uses the product to create your own collagen. So there's Sculptra, which essentially, the way I talk about Sculptra is, imagine a raisin. So I inject Sculptra into the raisin, and the raisin plumps up and fills itself out much like a grape. So that's a volumizer, and that's what Sculptra does. The other product that's kind of an in-between filler and biostimulator is a product called Bellafill. It has a component of dermal filler. So it's a implant material, tiny, tiny little beads around it. It's got cow collagen. We put it in just like filler, and then as the cow collagen gets consumed by the body, the implant stimulates the production of your own collagen. So those are the two volumizers. The other thing that we have is fillers, and fillers fill. So we usually place it strategically in the face, typically to restore the cheek. We'll plump up this area, we fill in a temple. We will often put it in the side of the face to kind of restore the dimensions of youth, which is full temples, eyebrow position higher, no interruption in the fat pads to create the same dynamics that we have in the face, okay? So in the family of fillers, we've got what's called HA fillers, and a lot of you might be familiar with the term Juvederm, or in the Galderma family, we've got the Restylane, and then we also have calcium apatite crystals, fillers, and that's Radius, so that's a little bit of a different type of filler. And so those are all the different families, and they're used depending on the FDA approval in strategic places in the face. Voluma is approved for the cheeks and the jawline. Radius Sculptra is approved for full face. Bellafill is also approved for, in the dermis, as are most of the other fillers. So common fillers: Voluma, Volure, Volbella, there's a lot of these, Juvederm Ultra, Ultra Plus, then we have Restylane, we've got Lift, we've got Kiss, we've got Define, we have Refine. So these are and then we have the Radius family. There's also another company, MERS, that creates Volatero, and there's a whole family of fillers in that way. Now, I think most of you realize that there's been some restrictions now in Illinois, and so treating with, out of mask is, until that order is lifted, we still have, we're not going to be able to do in the practice full face restoration if it involves removing the mask, but we certainly still can do neuromodulators in the forehead, in the crow's feet, between the brows. The other place that we really like to restore are earlobes. A lot of people, as we get older, we lose volume in the earlobes, and with women who have pierced ears, or even men, I'm not going to discriminate, when you lose that volume, your earrings just don't sit on the ears properly, and we can do some filler in the ears to plump them up, and that's easy area to get at. Another location is the back of the hands. This is often an area that ages all of us because our skin gets thinner, our veins seem to look more prominent. In the back of the hands, we get spotting, so we could do laser treatments or peels for the back of the hands. But this is a great area for us to improve the thickness of the skin, and it creates some plumping, which helps to, sort of take the veins and have them that they're not necessarily as visible, and it tends to help match your face for when you are actually able to not have your mask on. You take a sip. So typically we use, all of the different fillers can be used the back of the hand. I don't typically use Sculptra in the back of the hands, just because of the nature of the way that it creates your own collagen. It sounds like it would be great for that area, but it's not really that wonderful for that area at all. So, but for those of you who feel that they have to hide their hands, we can go in and actually do something about the aged hands. Okay, so getting back to facial aging, I'm just going to recap because I don't know how long I've been talking, so I want to make sure that everyone can see the visual. Remember that table with the tablecloth? So what the goal is to put back those extra pieces in the table so that the tablecloth is nicely stretched out and you still have all of that volume. And then we really look at trying to, restore how healthy the skin is. Now, a lot of patients, when I tell them about this, they will say to me, why is it that when someone's heavier, they don't look as old? Well, part of that is because when you are heavier, you have a lot more fat within the skin itself. And so the skin tends to be plumper. And when there's more fat in the skin, it actually does allow it to stretch out a little bit more. And so what that does is it really camouflages this aging process. And so it's not that if you have, more fat on your body that this doesn't happen. It does. And often I will hear, oh my God, I lost, 20 pounds and it all left my face. Well, what it didn't, what happened was that you may have lost some of the fat within the skin, you might have lost some visceral fat. And as a result of that, it's unmasking this process that happens to us um, throughout our life. Now, there are a few things that will impact this process. Number one, stress. How many of us are not stressed? I told my staff when they came back from, the lockdown in June, the entire world right now has post-traumatic stress disorder. So please be cognizant of that and be, extra kind to everybody. But stress really does a number on facilitating how quickly this process happens. Think of Barack Obama. When he went into office in 2004, he was nice and stretched out, youthful, and 8 years later, holy cow, he aged a tremendous amount. So stress can facilitate how quickly this happens. The other thing is cigarette smoking. So people who smoke tend to have this process happen a little bit sooner. UV, so UV radiation can impact how quickly this process happens. And UV, a lot of individuals aren't aware that UVA comes through the car window, and a lot of times the left side of the face is aged a little bit more so than the right because of UV damage. Pollution can have an impact on how quickly this happens. Medications, think of Keith Richards. He had lots of non-prescribed medications and he aged pretty poorly. And so certain medications can make this happen a little bit quicker. And then the other thing that can impact this is medications, both prescribed and non-prescribed. And, one of the early medications we gave patients with HIV really facilitated how quickly this happened as well. So, if you want to look more youthful, I almost forgot. Blue light, a lot of us who are working from home and you're in front of us, Zoom all day long, all of that light that is, hitting your face, while most of us don't really like how we look on Zoom, and it has brought people in to get Botox around their eyes for sure. But that blue light can also impact this process, and it can really wear away on the collagen of the skin. So, when I tell patients to wear UV protection, I say winter, spring, summer, fall, does it indoor, outdoor, it doesn't matter, you need to protect the skin. So those are the main things that impact how quickly that we age. The last thing that we do in terms of restoring all of this, and I wanted that visual again, is that there is another product that we use. They're called PDO threads. There's different threads that we use now. And picture those, every table has those little clips when you're having a party that you can stretch out that tablecloth and then clip the table in. Well, PDO threads kind of do the same thing. We've got PDO threads that will volumize and create thickness in the skin. So we use those for acne, sometimes to help with fine lines. And then we have pulling ones, those that kind of pull up on the skin. And then when we set them, it's much like that tablecloth being stretched out and clipped. So that's kind of the icing on the cake once we have defined back to having your face re-volumized and the fine lines smoothed out and the eyebrows and the eyes reshaped.